if I'm not living a life that's true to myself and true to my core values, which again do change, but if we don't take that time to assess and to really hone in on what's important to us and on our own human needs, I mean, what's the point? I can take everybody's opinion and try to, go back to the people pleasing. But until I really dig down and I'm okay with what I'm doing, it's true to me, it's moral, it's legal, it's ethical, that's really all that I need. And so external validation, yeah, I'm done with that. I have a lot of internal validation, and that's come through the shadow work, looking at those parts of ourselves that, or myself, that I wasn't comfortable with, and allowing that compassion to come in, and I'm glad it happened.
Hello, everyone. Welcome back to the channel, or welcome to the channel if you're new here. I have the amazing Dr. Sapna Shah-Haque. She's an internal medicine physician and the podcast host of The Worthy Physician, which is an incredible podcast. She helps you reignite your humanity with your passion for medicine. And I am so delighted to have her with us here today. So, Sapna, thank you so much for joining me.
Thank you for having me. I'm just a fan of what you're doing and some of the underbelly of medicine that we really don't talk about.
Oh, I appreciate, and I really enjoy how you do the same and how will we dive into something that many of us not only don't talk about, but suppress. But before
Yeah.
we do that, and before we talk about the discussion on emotions and the importance of feeling them, for the people who haven't met you, can you share a little bit more about you?
Sure. So, as Jillian had said before, I'm an internal medicine physician. I have been in rural Kansas practicing as a rural doc in one way or another for the last 10 years. And, through that journey, it's not always been the same. So for the first 3 years, I was doing pretty much traditional inpatient, outpatient consults, and that was great while I was trying to build a practice, but it became to the point of being on call or being called and expected to say yes instead of no. So really no boundaries. When I was on vacation, I've gotten called. I've gotten called on my weekends off. So it led to really a very big imbalance between work and my non-work life. And it might be, looking back, I should have said no. But again, there was this cultural expectation of, well, everybody else has done it.
Mhm.
Well, you're a doctor. And while that's true, I'm not married to medicine. I think medicine, the way it has the way it has been and the way it is turning to now, or the way that we are looking at it as, no, I didn't sign up to sacrifice myself and my own happiness to appease those that don't matter. Because if I need to, in the past, if I had needed to take some time away for family, in 2016, family was a family emergency, and there really wasn't any backup when I said, "Hey, I need to go," and the response was, "What are you going to do differently? What can you being there change?" And that's a big pill to swallow. It really made me look at, okay, this is not where I need to be. So I did pivot, and I did um, take a different job to be closer to family and outpatient only, but I still maintained a part-time clinic in my original part of Kansas where I had been practicing and where I'm still practicing. But what I found through that is that it was not, I thought it was initially just work. Like I thought it was work was too much. I couldn't cut it. And so I thought I was a problem. Come to find out, and it wasn't until 2019, 2020, after my best friend died from suicide in her office, also a physician, that I've really started reading about why in the hell would a physician want to take their life? You know, because we give up so much to study the art and science of medicine, because medicine is much a science as it is an art. That's when I came across burnout, moral injury, call it what you will. Um, Potato, potato. They both suck. We have the highest rate of suicide among any profession, women more than men, which is complete opposite of, statistics in the regular non-physician demographics. So why is it such? And then the pandemic hit, and that's when I had the verbiage to understand what I was feeling and to label it. I would say at that point in time, with Dr. Bicker's death, with the reading, what I had come across really made me think about what in the hell am I doing? And I don't want to work all my life and miss out on two young kids at the time. So I cut back even further, and that was a personal choice to 3 days a week, and that's what made me move back here to Winfield, Kansas. It was outpatient only, different structure, different administration. But I think that the mix of women my age and with similar family structures also prompted a lot of the change. So, I mean, that matters. Why? Because you have others that are saying, "Hey, yeah, I get it. I get how important family is." Um, because there's a difference between seeing it from a male's perspective versus a female's perspective. There's also a difference of the expectations when we go home, whether it's self-imposed or not.
Mm.
Um, and so that's when I went part-time, the pandemic hit, and that's at that point in time the worthy physician was born out of that chaos to try and find a way to discuss what was happening. Because I'm surely if the burnout rate, the moral injury rate was so high, physician suicide was so high, affecting more women than men, surely I couldn't be the only one.
I appreciate you sharing that. And also that feeling of being the only one. When I was in oral surgery, I was in the military, and it was between 2014 and 17. And when I was on call, I looked at my upper level and I said, "Do people become suicidal when they're on call?" And they didn't say anything back to me. And they did get me help. They told the program directors the next day I was in his office. But everyone knew I was getting help, but no one in my direct residency or, attending said, like, "Me too, I've been through this, you're not alone." So I internalized that as I am the problem. I am incompetent. I obviously don't deserve to be here. I'd already had low self-confidence and self-esteem. And the loneliness increased my distress. So when we're thinking about what's the best thing that we can do for people is validate that they are not alone, that this is unfortunately a very common experience, that they are not weak, and that what we'll talk a little bit more about today, the importance of allowing those emotions and really sitting with, okay, what's truly the next best step for me? Because I know for me, my discomfort with sitting with my feelings of inadequacy and worthlessness was to throw myself into more work. What was your coping skill at the first time where you thought, gosh, something's wrong with me?
Hmm. Yeah, that's the problem. I really didn't know how to work through that. Well, what threw me into making a decision was my mom had a major stroke, and being an only child, being 45 minutes away, I knew my place was not taking care of patients was to be at the bedside. And luckily, I had a lot of good friends, three good friends that were at least keeping me up to date on what was going on with her in her care. And we had family members there, but still not the same, right? Talking from physician to physician. So that first time, I didn't really have a way to deal with it. It was more of, let's just get through it and figure out the rest. Well, there was a catalyst that made me figure out the rest, and that was to cut back. Um, Instead of working, I still work 5 days a week, but it was outpatient only, not no inpatient. And then I think those weekends where I was not on call, I just quit answering my phone. I'm not going to do it. I'm going to go up and be with my family at 45 minutes away because that's important to me. I wish I would have, I wish I knew then what I know now. I know it's a very common saying,
Mhm.
but I wish I would have drawn boundaries and I wish I would have just stuck to them. It really came out sideways. I would lose my temper when I would be called, and I still do at times, but it's very rare. Maybe it's happened maybe about I think 3 times in the last 4 years, whereas previously it was being called on New Year's Day because they needed a consult. I'm not on call. Quit calling me. I still went in because it was the right thing to do for the patient. And toward the end of that stint, I just started leaving town. Shouldn't have to do that. That was me not wanting to ruffle feathers. But
Yeah.
if I'm out of town and I'm 50 miles away, I can 45, 50 miles away, I can't respond in a timely manner that's safe. So it takes me off the hook. I really wish I just had the gumption to say, no, can't do that.
I had a coach that told me one time I was beating myself up for my lack of boundaries. I worked for almost a half a year in 2021 for no pay. And I was really upset that I allowed myself to do that. I was really like, how the heck did I allow myself to do that? And I knew at the time it was the desire to have a sense of worth and feeling needed. I didn't prioritize my needs and wants. And so she replied to me, you often don't know where your boundaries are until they've been crossed. And so when you're getting angry, like when we get angry and resentful, like that's a sign, right? Often that we've been having our boundaries crossed for too long, or we're emotionally exhausted, or we've been doing something for so long that we can no longer tolerate it.
Hmm.
But yet often when we get angry and we lash out, what do we do then? We self-criticize, right? Rather than like, oh, have self-compassion. I wonder where that's coming from.
Right.
Did that happen for you, or what was kind of your assessment when you're feeling like you're having those times of being more angry?
Yeah. Back in 2016, it was getting mad at myself for losing my temper. And now it's like, okay, where did that come from? Why am I so triggered? Is it because of lack of sleep? Is it because I'm, irritable? What else is driving that? But I think my response and my insight has really changed over, let's say, a decade or a little shy of a decade. A lot of that is, again, is just, I think, in medicine and trying to get to medicine, trying to apply to medical school, we don't have time. We don't allow ourselves to have time to really enjoy and soak up life. We're also not really, or maybe I know I haven't been the best in my 20s and 30s to learn how to talk about my feelings. It was at times it was a point of discussion in the home, and at times it wasn't. It And so I think that, having kids really changed that. Going through therapy after the first anniversary of, Dr. Bicker's death, working with a therapist and life coach, that helped me understand emotions better. It's not like it's not like it came naturally, which is which is really interesting, seeing that we're human and we know about emotions. We're taught about them. We're taught about grief. We're taught about, coping mechanisms, but we're not really uh, taught how those tie into everyday life and being an adult, and how difficult just being an adult is hard. And then you add all the layers of um, debt, working, having a family life. And, congrats, kudos to those that can navigate it, you know, without any issue. Fantastic. But life is hard. Life is just hard. I mean, I think that's a given. It's the hard times that we learn, and it's through the good, the bad, the ugly, and the beautiful that I think, we at least I've learned to appreciate it all.
That's profound there too, because I feel that we're often, especially when we have this persona that we have to uphold, and oftentimes people want to present themselves with positive emotions, right? Even if I go to therapy right now, it's hard for me to talk about a negative emotion because I'm afraid that me talking about a negative emotion is going to come across too negative. And I mean negative as in like a low mood, right? So something negative to me means something that could potentially reduce somebody else's energy. So I'm like really mindful that I don't want to come across as somebody that's energy sucking because our society is like, oh, they're too negative, right? And I'm like, but I'm really depressed right now, right? In those moments that I want to talk about it. I'm like, wait, this is the place to talk about it. And it's really fascinating because I feel many of us, especially in where we are at in our generation and those that are older than us, I feel that people that are a little older, from my perception, is that they didn't talk about their emotions, right? And then that comes to when you're the child of those people, like they're not used to talking about their emotions. So they didn't talk about it to you. And then when you try to talk about it, they have this mindset or judgment that they have crafted from their own lived experience. But there's major consequences. And I'd love to hear from you the perceived consequences and needs to be able to label our emotions and to express them.
Yeah, sure. I mean, and I agree with what you're saying, right? Um, we were talking before the recording, and I know that I know it wasn't intended, but one thing growing up was, well, you know, let's not talk about the displeasing things, or let's not talk about anything that's going to be controversial as far as how you feel. Um, I think a lot of it was because of, like you said, the way that the generation before us or parents were brought up, particularly in a Latin Catholic household. Honor your mother and your father, which I think you can do that without being disrespectful. And my biggest thing was, okay, tell me why, so that way I can understand it. And it's more like, do as I say, not as I do, or because I told you so.
Yeah.
And for me, that's never resonated with me.
Mm, yeah.
Um, Number one is a power struggle and completely invalidates the other person's feelings. And it's more of, okay, let's talk about it. I may not agree with you, but I want to understand your side. And we try to do that with our kids. We try to, I hated the phrase, I told you so, because I
Mm,
told you so. So I try not to use that with my kids. But it's more like, okay, you know what, talk to when you're calm, or particularly with my 5-year-old. Um, so okay, if you're upset, and you don't stomp off, don't slam the doors, don't yell. You can be, at least those are the rules that I try to set. And why is that? Okay, yes, when you're mad, you could probably yell, but let's not have it extended. Let's not have things slammed, because that's just, we have animals, we have other, there are other people, we have neighbors. That's also very hard on the ears. But let's try to regulate those emotions. And again, this is what we try to teach. And but the biggest thing is, let's not have a yelling match. Let's talk when we're both calmer.
yeah, creating that space between, I think that's kind of core to the emotional intelligence that we are hearing about more.
Yeah.
And a lot of times, being an adult now and observing that there are adults that are still very reactive even in a professional setting. It's like
Mhm.
these lessons that you're delivering and you're providing for your children is about how to honor the emotion that I am angry. And when I am angry, I need to create space because when I'm in that mindset, whether I'm angry or anxious or irritable, I know that I'm not thinking like in a way that I can convey my thoughts in a calm manner and in a
Yeah.
productive manner. So I'm going to create a pause so that I can feel these emotions, collect my thoughts, and then present my perspective in a place where people can actually have a productive discussion.
Sure.
When you can regulate and not suppress your thoughts and beliefs necessarily when it comes to like, if you're angry, something's coming up and you want to talk it out, it's about how are you going to talk it out in a way that's conducive to processing through, that's productive, that's not going to put somebody on a defense, that's not going to just ignite this match of emotions.
Mhm.
And I find that we often aren't taught how to name our emotions. So we just might react and not know why we're reacting. And that creates this environment like it's not a safe environment to lean into.
Right. And again, you know, do I still lose my temper? Hell yes. On purpose? No. But then I'm asking, okay, what happened? Oh yeah. Okay. I was up last night because one of the kids was sick. And that's just the way it is. And who do they want? They want mom. And that's fine. Because you know what? Um I have I have coverage over the weekend. I can catch up with sleep. I won't have any obligations to work. And so I can rest then. Not to the point of sacrificing myself, but because you know what? I also enjoy being a parent. And I want to honor that role just like when I'm at work, I want to honor that role about being a physician. But at the same time, it doesn't mean that I don't lose my temper. It doesn't mean that I don't cry because I'm sad. But it's taken me, working through, I would say, doing the shadow work to be able to embrace my emotions. And I'm 41. These are things I wished I had known or learned better and exercised more thoroughly in my 20s and 30s. I think a lot of times we have maladaptive behaviors, and for me, it was a lot of suppression or, just finding something to distract myself, whether it was a movie or or music or not necessarily working more, but just something else so that way I didn't have to think about it. I try to stay busy even outside of work. But now I don't want to do that. I like doing things, but if I feel frustrated, sad, or really irritable, I tend to spin my wheels and to say, okay, what's the trigger? What's the reason behind this? Because again, it'll come out sideways and I'll hurt, people verbally that are around me. And that is not my intention, particularly with such young ears around. I don't want that for them.
You mentioned the shadow work for people who haven't been exposed to that. Can you share a little bit more?
The best way I could describe it would be acknowledging those parts of yourself that you're not very comfortable with. Now, I think it's very easy to put forth our best parts, the happiness, the goal reacher, the hard worker, but it's also not, you don't want to go to a dinner party and say, yeah, I feel like I'm an imposter. I feel like I'm a fake. I really don't have the amount of confidence that you think I do. And when you find that out, I really wonder, what would you think? I'm uncomfortable with my responses in life. I'm uncomfortable with my being alone with my own thoughts. Why? Because I'm uncomfortable. Why am I uncomfortable? I don't know. Maybe it's because I have regret. Maybe it's because I have anger. Maybe it's because I have guilt or shame. And I think that we're easy in society to shame and criticize others Um, I'm human. I'm sure I've done that, not intentionally, about what we see. You know, we're easy to criticize about mistakes. We're easy to criticize. Well, I wouldn't have done that. Well, you don't know what that person was going through, and if you been in that situation, could you have handled it with that much grace? We don't know until we are literally in that situation. But even that, and I was having this discussion with my uncle today. You know, even if we have been in the same situation, we each come with different experiences in life
Hmm.
that shape how we respond. So we can't expect that response to be the same.
Yeah, you said so many great things. One of my favorite things to do when someone does something that I am curious about, like it's not the way I would have done it, is to get curious. It's interesting. I wonder why they did that or where that thought came from.
Hmm.
And I often, when I hear someone did something and it like, oh, intrigues me, right? Because it's an interesting behavior. I learn when I get the opportunity to get to know more about them, shall they be vulnerable? And not everybody is, you may never learn about anybody, right? But when I learn more about them, I'm like, wow, my initial thoughts about that situation was so off or was just so partially formed. And now that I know about their past or their prior experiences or the lens from which they're viewing this from, I really understand.
Yeah.
And I think curiosity helps us to reduce judgment and it can be applied to self, right? If, like we were talking about earlier, you demonstrated very well about prior judgment of your feelings of like, oh, I just acted in a way where I became a little bit more reactive than I would have desired. But now it's, oh, wow, I was a little bit more, for me, recently was a really short fuse, which is out of character. And when I don't like to be short fused, I'm like, okay, what's going on here?
Hmm.
And get curious, like you were talking about how you're saying, well, I didn't get any sleep. And what I heard in that reframe was the self-compassion of this is the reality of what I was facing at the time. Of course, I'm a little bit less able to hold all my emotions in because I am overloaded right now, right?
Yeah. No, I think that's absolutely true. You know, I don't just like I wouldn't expect my 5-year-old to have it all together, and the listener might think, why in the world would you ask him not to slam a door? Well, you know, if we get one out of the three right about, not stomping off. And again, I don't it's not that I don't want him to be mad. If he's truly mad, son, go, I want you to be mad. But let's learn to do it in a healthy way instead of, throwing things, slamming things, breaking something, because I've been that adult. That's not a good way to handle things. Mind you, I was probably about 21, 22, but it's not a good way. We know that just if we don't learn how to self-regulate and go into anger to be our first emotion, it's a lot of chronic stress. That's a lot of chronic cortisol. We know that stress can kill. So I think that learning early coping skills, again, I'm telling you, as a 41-year-old, I wish I would have had better mentorship with this. So hopefully trying to set some of that, with the kids, with myself, and I'm just trying to pass on what I'm as I'm learning. And they make me want to learn more and be better at that. Why? Because I have several great reasons to live. Hopefully a well a well thought out life, I'm not gonna say well planned because I'm not where I plan to be. My 20-year-old self would kick my 41-year-old self's tail because this was not where I planned to be, but I love it. And for right now, we're at where we're at because that's where we need to be. And I truly believe that our basic needs are being met. And for right now, that's in a crazy world and crazy times. We have safety, we have security, we have a loving community that is both medical and non-medical that is very supportive. And for me, you can't put a price on that.
And also thinking back to that 20s, we are pressured to create these long-term goals in our 20s before our
Yeah.
brains are fully formed, when our core values are much different than they are later in life, even early 20s, mid 20s, late 20s. There's huge shifts during those years of life. I find myself often judging, as I left a surgical residency, I was medically discharged from the military. My ex-boyfriend passed away, and I had always wanted to be a soccer mom, and I'm single at 35, almost 36, with no kids. That's not the life I envisioned, and it's the right life for me in this moment. But you gave yourself some permission to pivot from the full-time job, from the part-time, to part-time, and give yourself permission to create a life that's different than in your 20s. And I found giving myself permission to pivot was so hard, because we're often taught that once you commit to something, you're a failure if you quit. And there's so much of what we have learned in the past that needs drastic reframes,
Yeah.
because quitting on my life would have meant staying in that residency when I was feeling suicidal, when I was having a whole bunch of unprocessed grief from my ex-boyfriend passing away, my co-resident passed away, and I was coping poorly because I wasn't taught how to process emotions either. I internalized it. And I think when we internalize, for me, my coping strategy to numb was an eating disorder, which was life-threatening. But that same coping strategy can look like substance use,
Mhm.
alcohol, overwork, some things that are more societally accepted, where you're not like, oh, that's a problem, but we're numbing ourselves or distracting ourselves through the discomfort of feeling like what's really happening here. So I think your message about really stopping to consider what's going on, and maybe that life goal I planned for myself 20 years ago isn't what I actually want today, and that's okay. It's actually to be expected.
I think it's the norm versus the rule.
Yeah.
The funny thing is that we have 18, 20, 25, 27-year-olds, 32-year-olds that we expect them to figure out life and to have this map for life and then hold them to that, I think is very bizarre, is sadistic.
Yeah. Yeah. It is. And it's laughable now, but like, how concretely did we believe that we were, like, that was something that we should really hold ourselves to high standard to commit to?
Uh, no, I'm no, 100%. It really wasn't until my 30s. I think it was 31, 32 when I woke up and I'm like, "Oh hell no, I'm not doing this." You know, I'm not doing this. And the truth is, if anybody's gonna sit there and say, "You're crazy because you signed up to do this," I'm like, "Hey, look, I signed up to be a doctor and I love medicine, but I'm gonna practice it on my own terms. And I have a place that allows me to do that because they realize the humanity and I communicate with the patients. Um, for the most part, I think everybody understands. Like I'm human. I'm not a robot.
Yeah.
And as long as I'm paying my bills and nobody else is writing a check for me to pay my own bills, their opinion doesn't matter.
And what you said earlier, when they give you their opinion off of your life choices, it's a reflection of their own internal expectations and biases.
Right.
And our response to it and our feelings about those opinions are a reflection of our own internal biases. So, like, if you tell me something about what you think about my life and I feel a certain way about your opinion, then there's a lot of things to digest there. It's understanding where your perspective comes from and understanding what it's bringing up for me.
Right. And I everybody has their own opinion, and that's fine. But at the end of the day, I'm responsible for my life and my choices. And if I'm not living a life that's true to myself and true to my core values, which again do change, but if we don't take that time to assess and to really hone in on what's important to us and on our own human needs. I mean, what's the point? I can take everybody's opinion and try to, go back to the people pleasing. But until I really dig down and I'm okay with what I'm doing, it's true to me, it's moral, it's legal, it's ethical, that's really all that I need. And so external validation, yeah, I'm done with that. I'm done with that. I have a lot of internal validation, and that's come through the shadow work, looking at those parts of ourselves that, or myself, that um I wasn't comfortable with, and allowing that compassion to come in, and I'm glad it happened. I don't like what triggered it, but I'm glad it happened. I'm glad I was smart enough and took the time to do the inner work. Um, because I think it's helped me be a better person. I think it's helped me be a better physician, um, just better, participant in society.
And you did the shadow work, and what other resources have you found to be helpful?
Um, I being Catholic, I'm not a very good Catholic, but um, going back through some of the Catholic literature, particularly Saint John of the Cross and Saint Teresa of Avila and Saint Faustina, um, going through that, listening to the English translation of the Saint John of the Cross's The Dark Night of the Soul, because I'm not going to sit there and read, Castilian Spanish from the 1500s. 20 years ago, I would have. Now,
Mm.
no.
Mhm.
But also, um, going back, and I forget the exact name of the book, but it's basically Beginner's Guide to Buddhism, and then going back and going through the Catholic prayers, particularly the Rosary. But and I'm not religious, but in times of, I would say, difficulty and trying to discern what the next best step is, I do lean on those tools. So those are things with which I was brought up. The Buddhism, I like the principles because I think the teachings help me to be a better person. Really try to embrace as much as possible, kind of a non-judgmental approach, and try to approach with more compassion, and self-compassion is part of that. So I find it not so fire and brimstone, more accepting of where meeting people where they are at that point in time, and that includes myself.
Yeah, that's beautiful. And you're bringing the humanity back into the discussions on your podcast. So, would you mind sharing a little bit more about the Worthy Physician podcast?
Sure. So the Worthy Physician podcast, that was born about a year and a half after Dr. Becker's death. Again, I had been going through trying to figure out how to mourn a friend's death that was unexpected and of a nature that I didn't understand. I There was grief, and I didn't know how to grieve that. Like, I didn't know how to grieve that. Um it was different than losing, you know, an elderly family member because they were decrepit, or a physiologic issue, and not a mental health issue, not to diminish mental health in any way, but it was death by suicide, and or from suicide, and I didn't know how to process that because it was uncharted territory. There were a lot of layers to that. She felt that, well, there was fear for getting true professional help because of professional repercussion. And
Yep.
you know, it's hard to remain in a profession that that is like that.
Yeah, after I had time to process what I experienced in surgery, I realized that most of us would risk our lives for our career, which is where my article, I risked my career to save my life, came from. And I was actually self-critical about doing that because we're taught to sacrifice. And I was in the military, which is service before self.
Hmm.
It's one of our core values. And then it was like, oh my gosh, eye-opening. We would rather stay quiet to protect our license than speak up to protect our lives. And even when we say it, it doesn't become clear cut because the fear of, well, if I lose this license, I don't want to live is a real thought. And often it's offered to us when we're sleep deprived and when we feel trapped and when our identity is too tied to our career, where we don't know who we are without that title.
Yeah,
And so if we can provide people the opportunities, like you're worthy regardless of your title, you are never trapped, you always have options. Don't make big life decisions when you're sleep deprived. Nothing in your career is more important than your life. Like, what needs to happen for those statements to be true? And that will be unique and personal for anyone listening, but it's something I'd really push us to reflect on, and hopefully before it becomes critical. So you have a plan in your mind about how to save your life if you get to a state where you question whether or not it's worth living.
that's beautifully said. You know, there are ways around to get around the debt. There are ways around the title. I mean, okay, even if you're not practicing medicine, even if you lose your license, you're still a physician. You still are taking care of the number one, and that's yourself. You know, there's no clause in there that says until death do us part.
Yeah.
We're not married to medicine, honey. And even if we were, there's divorce all the time. So what? You know, I think that's we're willing to say, okay, I'm divorced versus I left medicine. I mean, there's more compassion with the for the those that are divorced. And I'm not again, I'm not passing judgment, but I'm just saying that, you know, we have no problem saying, yeah, I'm divorced or I'm this or I'm that, but oh my God, I left medicine. How dare I say that? Or I'm thinking about leaving medicine. How dare I say that? Right? I mean, that's so taboo.
It's taboo, and there's this hyper judgment. And what I've learned through observing the comments that might come across in social media is that people who feel trapped are more likely to comment against those who are leaving. And people who feel that they are indebted to medicine, or this is an observation, of course. So, I mean, I'm sure there's a huge variety of other options that exist, but what I feel is that many times if you don't feel you can make a choice that's different than the one you're making, that if someone else makes it, we're more likely to feel activated and against that, right? Like I think Brene Brown would say it's more of the envy or something, that whatever that person's projecting, I wonder what's at the core of that. And because for me, like people pleasing has been a huge part of my life, that if someone tells me I'm doing something wrong, I'm a huge rule follower. Like I'll cry if I break a rule. And some rules are meant to be broken. So that's shifting over time. But it's like if someone tells me I did something bad or I get in trouble, I'll cry. So when people judge you for wanting to leave, like when I left surgery, I I kind of leveraged how ill I was in order to just say, well, of course I'm not going to continue because I'm inpatient for anorexia. I'm like, of course I have to leave, rather than just voicing when I was in a state of more healthy mind and body that I don't think this is the right career for me. I think I'm going to pivot while I'm healthy. I couldn't form the words. So I allowed something else to speak for me, which was very catastrophic and risky. And, it made me question, like, why do we feel so much resistance to just saying, I think I made a choice that wasn't my best interest, or maybe that was best for me previously, but it's no longer good for me now.
Yeah, I think a lot of it, like within medicine and in general, it attracts high achievers, people pleasers, real followers, type A personalities because of how many hoops and rules and all these extracurricular activities we have to do in order to even have an interview for medical school and then for residency and then for fellowship. It very much embodies exactly what you have described. And so when we say, I'm going to change or I'm going to, like, yeah, okay, good. My question is, at the end of the day, are you happy? And if you're not, then damn it, do something about it because it's your job. Like like we tell our patients, you're responsible for your health. Well, you're damn it, you're responsible for your happiness. If you're unhappy, start finding a way to make your way down that path of happiness, whatever it looks like. And even if it's just getting it on paper, do it. But, don't and I'm happy that you pivoted, and I'm happy that you're here, and I'm happy that we're having this conversation. Because your life matters. Your humanity matters. Nobody on their deathbed says they would have worked more. So why are we pushing that fallacy?
Yeah.
You
Yeah.
know?
And people are, so I posted something today about like what is in your agency, questioning, because because a lot of times when we feel trapped and we bring acknowledgement to the system problems,
Mhm.
then like having conversations about going to therapy or going to coaching or doing things that are self-care related become triggers for people.
Mhm.
Right. And I was like, I'm validating that there are a lot of obstacles that are not within our control that are causing distress. And what is in your agency, so you're still in the driver's seat, you still make choices, like you're not trapped. There is a vulnerability when people hear like take control of your life, when they're in a state of burnout. And I was like this too, right? And you're just so fried. You're like, I have no control. I feel trapped, like, or you in a work environment that just feels so oppressive. And I validate that there is true oppression existing.
Yes.
And where do you have agency? And I hope that people can take it as empowering and not victim blaming, because that's what it's meant for.
Right. No, I'm in no way, shape, or form blaming anybody. We should have prefaced all this by saying, with a open, conscious, and rational mind,
Yeah.
which is uh ideally fed, slept, and maybe plus or minus caffeine, right? So when does a kid throw a fit? When they're hungry, when they're sleepy, when they're frustrated and they can't find the words.
Mhm.
Well, not much really changes with as an adult. I still get cranky when I'm hungry, when I'm sleepy, and when I can't find the words. When can I not find the words? Well, when I'm sleep deprived for sure. When I'm an emotional overload, when I'm overstimulated, right? So I'm in no way victim blaming. What I am going to say is sometimes you have to hit a wall in order to understand that something has to change. And hopefully, this conversation that we're having is going to allow people to not have to hit that wall and to understand, okay, this map that I put out for myself at 15 or 18 or 25 doesn't have to exist that same way. Why are you going to hold yourself to an adult decision with something that you made with a not completely full or fully formed brain? And even if you made it in your 30s, I mean, my trajectory changed and I'm okay with that.
Yeah.
It's being human. I mean, it's living life. We're not robots. We're not an assembly line. I think we forget about the journey. And that's with good and bad experiences. And that's for me, I'm gonna write out my path. And yeah, it might change I wouldn't say every 6 months. But what I do try to do about every quarter, sometimes every couple of months, is to make sure that I'm living a life that is within my that is aligned with my core values. And I can only do that if I have, some quiet time, some space that I make sure that I carve out for myself. That's what has helped me. That is, as let's even put being a physician aside. That is just what has helped me being an adult, juggling many balls in the air. Because life is tough, life is hard. There are bills to pay. Um, there are multiple hats. Nobody talks about the sandwich generation with aging parents and kids, and no, it's a reality. It's ugly. It's ugly. But there are so many beautiful parts of that that I wouldn't trade for the world. But it's hard. But I don't feel guilty by saying it's hard. I don't feel guilty by saying, yeah, sometimes it sucks and I want to run away and I want to sell and not literally sell, but I want to, you know, just put put my kids with somebody else for a couple hours, and
Yeah,
that's what a babysitter's for, right?
yeah,
I think people can relate to that, and or having a dog sitter, having a dog walker. We've talked about that,
yep,
right, beforehand. That's because that comes from a place of love. We want to leave our the ones that necessarily can't talk or advocate for themselves. We want to leave them in good hands.
yeah, definitely.
But we can do that. We also need to leave ourselves in good hands, and that's by making sure that if we're not happy, getting the resources in place that will help you to get back into your true state, your true nature.
Yeah, that's beautifully said. And even happiness is a fleeting thing, right? I was reading Arthur Brooks' books, which he talks a lot about happiness isn't quite a destination, but it's part of the journey.
Mhm.
And you don't just become happy like and you're done, right? I'm always happy. It's part of the journey, and you can become happier and have those fleeting times where those down times are to be expected, and to not judge ourselves for them or feel. Sometimes I get caught if when I'm like in a low mood that I just think it's always going to stay that way, and not just appreciate that that's the ebbs and flows, that you got to feel the suck and then you also got to embrace the beauty of life, and sometimes it's at the same time.
I'll just give you this example. My mom passed away about uh, a month ago, and while we were planning the funeral and we had a private family viewing, it was her youngest brother's birthday, and said, "Okay, we're here to mourn her death, but at the same time, we're gonna go out and celebrate your birthday because you're here, you're alive, you're not in the coffin." And it's not to dismiss. Believe me, I miss my mom, and I'm not. But at the same time, she lived a good life. She lived life to the fullest that she could. And one thing she did teach us was to enjoy the moments when you are alive. So we did the next best thing. After the private viewing, we went to a Mexican restaurant and had some damn good Mexican food. And we
Which,
celebrated his birthday.
yeah,
And we went from crying to laughing. And so it's just a juxtaposition of emotions. But did I feel guilty for going out and having a good time on such a solemn day? No, because we were still celebrating the ones that were living, if that makes sense.
it makes a lot of sense. I think about that a lot for the people who pass what they want. When people's loved ones pass and spouses pass, or my ex-boyfriend passed and I'd feel guilty about dating someone. We weren't dating when he passed, but I'd still feel guilty about dating someone or being happy. Or I was like, okay, well, what would he have wanted? In order to honor their lives, we need to live a life that's fulfilling, right? I don't honor his life by making mine suck because he can't be here. I'm going to sabotage my life. But in moments of depression and grief and those negative feelings, our brain can offer those suggestions. And I value that you showcased how you can feel the grief and also have the awareness that we're going to celebrate this person's birthday, and to be able to really focus on, I didn't know your mom, but I anticipate that's what she would have wanted you to do.
Yeah, because family was everything. Good, bad, and the ugly, the beautiful, right? Family was everything.
Yeah.
And so we did, particularly that week, we did everything as a family. And that's continuing. And the whole point is we're all gonna die at some point. Live life that you truly love. You know, on one of my podcasts, middle of I think it was beginning of February, maybe it's the middle, kind of getting back into the swing of things after dry January. Um, on December 28th, right after Christmas, I had a few moments by myself with her, and without one of the kids or without somebody else. And not to say that that was great. She was very loved, but she gave me some great advice. And I actually recorded it. It's one of the one times she let me record it, and I'm so thankful for that now. But it was, quit being so hard on yourself, because you know where you're going, and just add more variety to life. And I thought, wow, even her advice to me over 20 plus years has changed. So the view, or the lens through which we view life, changes. And that's okay, because that means that we're doing something that has changed us at our core, or has changed the way we see life. That's not necessarily bad. We've changed as human beings, and I think that's what being human's about. It just depends if we learn from it or if we don't, or how we incorporate it. And sometimes we can't do it at that moment, but what are we gonna do with that later on down the road? That's what's important.
Yeah. I think that's a great takeaway. Well, you've shared incredible amount of messages for the audience, and I do hope they reflect and take in and absorb and apply. And for people who would like to get in touch with you, can you share where you can be reached at?
Sure, I can be reached at theworthyphysician.com. I do have the social media links as well as email on the foot of the landing homepage.
Awesome. Of course, I highly recommend they tune in to The Worthy Physician. There's so many wonderful conversations. The diversity is incredible, and you're a wonderful podcast host.
Thank you very much. I enjoy it.
Well, thank you, Sapna, for joining me today.
Thank you. Thank you very much.
And thank you to the audience. If you have any thoughts, reflections, or comments, please share them down below. And until next time.